All month long, we've been tackling an important topic, that of hospice care, and it has generated many thought-provoking conversations and also revealed details that many people have not been aware of. Today, we look at the difference between hospice care and palliative care. And joining me is Dr. Jennifer Hirsh. She's the medical director of Zusman Hospice at Wexner Heritage Village, along with Molly Hogue, whose family was helped by Zusman. Ladies, nice to have you both here.
Thank you, Gail.
And Jennifer, you know, working at Zusman, being the medical director, it is a difficult time for families. When they come to that stage where they think they need hospice, what's that first step they should take?
Well, hopefully it's a process. Ideally, someone has had a conversation with their physician or their healthcare providers that the aggressive medical care is no longer helpful, and it's time to really focus on quality of life. So sometimes the call comes to us from a medical provider, but family members are also welcome to call, and sometimes they call months before their loved one even is going to need hospice.
And you think that's the best to do?
I do. I think that getting comfortable with the situation, getting comfortable with what hospice entails, and getting comfortable with the people who will be involved in caring for your loved one helps a lot. There's nothing that's going to take away the heartbreak, but being with hospice and hearing the education about what we can do and what the process is like takes away some of the fear.
Explain now the difference between hospice and palliative care. We hear them together.
Sure.
I know they're not the same thing.
So palliative care is the type of medicine that we practice. Palliative care traditionally in the United States is offered right alongside the aggressive medical care that you're getting in the hospital. So you may have chemotherapy, you're having nausea, you're having pain, so the palliative care team can work right alongside the oncologist in treating those symptoms. If you're working with a cardiologist, you've got shortness of breath, the palliative care team can complement the services. So that's the same type of medicine that we provide in hospice, but hospice is a government-defined entity in the United States. In other countries, they're actually sort of considered the same thing.
So that would be the best process, though, to use both of those together?
Yeah, ideally it's a transition, and that's really what happened with Molly's dad, too. When he was in the hospital under the care of an oncologist and a cardiothoracic surgeon, the palliative care team was also part of Molly's dad's team, and they helped manage his pain in the hospital. And then when he transitioned to hospice, I was sort of able to follow up on what they had started.
Molly, what did hospice mean to your family going through this with your parent?
Hospice was amazing. I mean, I had been doing so much, and then having hospice there, it was kind of a huge relief. They helped so much with holding my hand through everything, helping me make decisions, helping me explain things to my dad, helping me understand things that he was experiencing that he couldn't even explain. But the biggest thing that they did for me, when he moved from the inpatient unit to the nursing home staff was confused about not confused, but they were concerned about how much pain medicine he was getting, because part of what he was dealing with was chronic pain. And they kept saying to me, we're giving him too much pain medicine. We're worried we're over-medicating him. And I was like, no, that's not true. And so hospice came in and explained how someone with pain like his, it's different. It's not like somebody like you or me after surgery, we take pain medicine. It's very different.
So somebody was your advocate for you and your father.
Hugely my advocate. And, you know, you don't realize it. I thought I knew what hospice was, but until I experienced it, it was a huge relief every day. I was so thankful. I could sleep better at night.
And it does encompass a lot, doesn't it?
Absolutely. I was amazed.
Realize. And Dr. Hirsh, we have a picture of you at Zusman, and you have a 10th anniversary coming up, and I know you'd like people to come visit, see what you have to offer.
Yeah. We've invited really anyone who's ever had an interaction with Zusman to come to this event. There's information about it on our website, so even if someone didn't get a specific invite, there's posters and the information on the website, as I said, and we've invited people to come celebrate with us and observe it.
It's Wednesday, November 16th, and I noticed you said celebrate, and that is a theme, I think, of different folks that I've talked with hospice. You really do look at it like that. You are celebrating this person's life and helping to make those last days comfortable and caring.
And to make it a time for family to really enjoy what they have.
Together.
Absolutely.
Yes. It is a pleasure to talk to both of you. Thank you so much for being here.
Thank you.